begin our COVID update as always with a situational update. We have 8,183 cumulative positive cases of COVID in our county. Past 7 days, 214 new cases. Past 14, 446. Our 14-day case rate per 10,000 as of the 11th is 96.9. It is down a little bit from around Thanksgiving, although it still remains pretty high. We're still getting a fair amount of new cases coming in every day in the 20s, 30s, and 40s. Deaths were up to 107. That's 12 since the last time I was in front of you. So still having a large amount of deaths this fall and entering into winter. Average age of positive cases in the last 2 weeks is 38.4. Cases in school down to pre-K is 24%. We were down into the mid-teens around Thanksgiving, and we've gone up a little bit again in the last 2 weeks. Of our 5 and older population, we have 60.3% that have began their vaccination series, and of our entire population, regardless of age, 57.1% have received at least 1 dose of a COVID vaccination. Some upcoming clinics, we've hosted a fair amount of booster clinics. The interest has decreased a little bit. With our last one, the first few we filled completely. We have 2 work sites up and coming that we offered the original series on site. Now we'll offer boosters on site, plus anybody who wants to begin the series. Working with a couple organizations that are addressing some vaccine mandates, and we'll offer some clinics for them. And then in January, we have a Johnson & Johnson clinic from 3 to 5 at the Itasca Resource Center, and we'll have a Moderna clinic January 25th from 1 to 3 p.m. You can access Pfizer for ages 5 and older at all 3 of our healthcare clinics. You can also go to Walmart and Thrifty White. You just need to make an appointment, as Pfizer is the vaccine that requires a little bit stronger storage and handling requirements. Moderna you can access at Thrifty White, Walmart, Walgreens, CVS, Scenic Rivers, and then Public Health. And Johnson & Johnson, for the most part, is just public health. We still have influenza vaccines. There has been influenza identified in Itasca County, and so we strongly encourage you to start this series. Christmas is a little over a week away. You have time to build some antibodies and not share influenza or COVID with your family if you choose to get together. Delta does remain the active variant in Itasca and Minnesota, although we have identified Omicron in Minnesota. Although we haven't identified it in Itasca yet, just looking at Alpha and Delta, it likely already is here or it's coming. We haven't been immune to that at all. Only a subset of the PCR tests can be sequenced out for variants, and so we can just assume, again, it's coming or it's here already, and we just haven't found it yet. Presumably as viruses go, it likely is more contagious. Whether it has poorer outcomes remains to be seen. But as these viruses progress, you can always assume they're going to find ways to survive, and so would be more contagious if that's the case. Vaccines do remain effective against the variants in preventing severe illness, hospitalization, and death. Data supports that. I know there's other narratives out there, but data strongly supports that the majority of those becoming severely ill are unvaccinated. Our schools, we work with them weekly plus, and they all have varying levels of mitigation strategies, masking, distance learning, whatever's happening within their buildings. It really is varied right now. The schools do know what's happening within their geography every week. We calculate that for them, and they're utilizing that to make decisions. Vaccine breakthrough, 4% of our fully vaccinated residents have tested positive for COVID. This is updated once late in the week, and so this is as of last Thursday, Friday. That's 1,027 of our 24,451 fully vaccinated folks that tested positive. Of those 1,027, 62 were hospitalized, 12 died from COVID. Our hospitals, we are receiving updates from them, if not weekly, every other week, and the story remains they are on and off divert. They remain having boarders in their ER, meaning these folks require either admitting to their hospital or requiring higher levels of care that are really a struggle to access in our region and our state. There was a media campaign that the large hospital systems throughout the state of Minnesota signed on to about their experiences. The headline is they're overwhelmed and heartbroken, and they're seeing an incredible amount of death, probably more than they'll ever see in their careers. Just really having a hard time with folks needing that higher level of care. And Essentia signed on, mHealth Fairview, Grand Itasca will, NPR covered it, and it is something we should all care about because it's not just COVID, it's other critical care needs that we may not be able to access should we need to.